Sometimes I think the best way to understand something is to understand what it's not. So before I define what mental illness is, I think we should start with what mental illness is not. And I want to be very clear that mental illness is not something that is all in your head. It is not a moral failing. It's not simple laziness. It's not a lack of faith. I hear that often. It's not sin, and it's not something that you can just get over any more than you can just get over another medical problem. What it is a real brain disease. Your brain is an organ, and it can become diseased just like any other organ in your body. Mental illness results in significant changes in the way you perceive the world and the way you interact with the world. And although it is very treatable, it can also be very disabling if left untreated. So when I talk about mental illness, I like to use an analogy to diabetes. And when I'm talking about diabetes, I hope that we're all familiar with this, but just to be clear, talking about type 2 or adult onset diabetes. This is the diabetes that people tend to get when maybe their diet isn't the healthiest, they may be a little bit overweight, or their weight's not where it should be, or maybe they're not able to exercise. This type of diabetes we know arises from an interaction between our genes and our environment, and those two things together lead to the disease. So what do I mean by that? Your genes, your genetic predisposition, which is a fancy doctor way of saying your family history. So we know that people who tend to develop diabetes usually have a family history of it. It usually is something that runs in their family. So when they have that genetic history, and then they also encounter maybe not eating well, their weight getting too high, gaining too much weight, or perhaps not exercising well, those two things together lead to the disease diabetes. And what we know is that many psychiatric disorders, many mental health conditions are similar. If we take depression as an example, we know that depression runs in families. We know that there is a genetic predisposition to developing depression. Even children who were born to parents with depression and are adopted and raised in an environment where there is no depression have an increased likelihood of developing depression. So we know there's a genetic risk. If you have that genetic risk and you encounter certain environmental stressors like loss, early childhood trauma, significant, stress and isolation, those two things, the genetic risk and those environmental factors, can interact together to lead to the disease, the brain disease, depression. Now, you might imagine a situation where someone with diabetes has such a strong family history, such strong genetic loading or genetic risk for diabetes, that even if they keep their diet healthy and their weight is good and they're exercising, their genetic risk might be so great that they still develop the disease diabetes. And that can be true with some mental health concerns as well. Maybe you have such a strong genetic risk of depression, that even in the absence of those environmental risk factors, you might develop it. Or the opposite. You might have someone who has a very low genetic risk for diabetes, but with enough bad environmental stressors in their life, if their diet is bad enough, if their weight is out of control enough, or if they are really not, struggle with their physical activity, they might develop diabetes. And the same is true with things like depression. Even without a genetic risk, if you have enough loss, enough isolation, enough trauma, enough stress, you might find yourself developing the brain disease of depression. And what I want you to hear, and I hope every one of you will take away from this, is that it does not matter if it's your pancreas, which is the organ involved with regulating your blood sugar, or if it's your brain. You have no more control over your organ developing a disease when it's your brain than you do if it's your pancreas developing a disease, right? Somebody with diabetes can't just say, pancreas, make more insulin and control my blood sugar better. And somebody with depression can't just tell their brain to not be depressed. It doesn't work that way. If you think about how our organs work, picture the heart. The heart is responsible for pumping blood to the rest of the body. If the heart gets diseased, it struggles to pump the blood well. And what you start to see when people have a condition that affects their heart is you see impact because the heart's function is impacted. When somebody has brain disease, it's going to affect the things that the brain does. It can affect our motor and sensory behavior, like when someone has a stroke. But the other thing the brain does is it thinks and it feels. And so when we get brain disease, it can also affect how we think and how we feel. So this is a disease, a physical disease, just like any other condition. And I want you to really hear me that depression is a real disorder with biological changes. So besides just feeling sad, depressed patients have whole body symptoms. They have an increase in their stress hormone levels, cortisol. It impacts their sleep. It affects biological symptoms like sleep and appetite. It changes the neurotransmitters in their brain, and it even impacts their immune system, which is what your body uses to fight off infection. So it has a whole body effect. Okay. And this is about as sciencey as I'm going to get on you, but this is a picture of a PET scan. What a PET scan does is measure the brain activity. And in the picture that is labeled healthy right here, what you can see is a lot of bright colors. Those bright colors represent normal activity, lots of activity happening. The brain that is labeled MDD, that's our medical abbreviation for depression. It stands for major depressive disorder. You see more subdued colors. So there's less activity happening in the brain. So even when we look at brain images, when we're looking at brain function and blood flow, oxygen use, that kind of thing, you can see a difference. And so this is a real brain disease.